Right here 24 hours ago, we pressed the state of Colorado to provide more accurate numbers on COVID-19 deaths in our state. Today, the state health department acted, and it's going to make things a bit confusing. They're separating the cases where people had the virus and died from the cases where people had the virus and they can prove that's why they died. It has dropped the total number of COVID-19 deaths in Colorado from more than 1,100 to less than 900. You can look at this two ways, all right? Either it's public health officials trying to clarify confusing data collected during a crisis, or to cover up a crime. A Republican state legislator wants Colorado's top health official to face criminal charges. Here's politics guy Marshall Zellinger.
Republican State Representative Mark Baisley sent this letter to District Attorney George Brockler, wanting criminal charges filed against Jill Ryan, the head of the state's public health department. The letter suggests she's falsely altering death certificate numbers, inflating the number of deaths due to COVID-19.
Obviously, the consideration of criminal charges is completely inappropriate.
According to Representative Baisley's letter, his reasoning comes from a notice from Summer and Glen, a senior living facility near Arapahoe Road and Holly Street in Centennial. Last month, the facility wrote that CDPHE was going to override and reclassify the deaths of residents. 4 resident passings have been directly tied to COVID-19, the letter said. CDPHE will now list Summer and Glen as having 7 COVID-19 deaths. When I asked an executive at the facility what that meant, she told me they were trying to be transparent, but would not explain if the discrepancy involved patients who tested positive for COVID-19, but then perhaps died of other causes, which we learned today has caused the COVID-19 death statistics to be reorganized.
What the people of Colorado want to know is not who died with COVID-19, but who died of COVID-19.
Like the Montezuma County case Chris Vanderveen told you about yesterday, the man who died from ethanol toxicity, alcohol overdose, but he also tested positive for COVID-19. The governor told us the CDC requires apples-to-apples record keeping of people who died with COVID-19. Now those who die with COVID will be counted separately from those who die from COVID, at least when the data is presented in Colorado.
When there is gray area, we should always use for reporting the numbers that come from the physician or the coroner that actually addressed the patient or inspected the body, not somebody ever second-guessing it from behind a desk.
I reached out to District Attorney George Brockler, who told me in a statement that it's too premature right now to talk about this, but one way or the other, he will reveal once he's looked at this, he'll say whether there is something going on or not. He'll make that public either way, Kyle.
And certainly we've asked for accurate numbers. We have asked for clarity where possible. But at the end of the day, there are going to be some number of cases where they just don't know. They're not always doing COVID-19 tests on people who have passed away or risking an autopsy.
And even with the CDC requirements, you don't need a positive test to necessarily be lumped in with those cases that say you're a COVID-19 death, which is why today's separation of the numbers will be helpful moving forward, but super confusing as we look backwards now.
Yeah, accuracy and clarity are not always present at the same moment. Marshall, thank you. Representative Baisley told me by email, quote, "I have tried to imagine an honorable reason for overriding a physician's professional determination of cause of death, but without hearing justification from the executive director of CDPHE, I can only conclude that replacing the truth with a falsehood is inappropriate. Most important, if we in government do not remain open, honest, and transparent about the facts of the pandemic, how can we expect Coloradans to trust the emergency orders?"